the energy behind addressing this crisis, but it also speaks to the severity of this crisis. And hepatitis is not in the headlines that often. That's one of the reasons it's so deadly, because there's so many people suffering in silence, and that's not okay. That's not okay. Good news is we got an administration putting resources behind this, and you've got a city council with you. The city council of New York City, we are standing with you. We have to ensure that in this budget that we put funds behind that commitment. Every death from hepatitis and every case of hepatitis is 100% preventable. 100% preventable. But what are we going to do to get there? We have to put resources and energy behind it. We've got our commitment to do that. Let's go do it. Let's go do it in this budget.
Yes.
Thank you for your words, Councilman Butler, and thank you for the commitment and being a partner with us. I'd like to call now Abigail Hunter, who is a nurse practitioner at Mount Sinai. Hi, everybody.
Thank you for such a wonderful turnout. My name is Abigail Hunter. I'm a nurse practitioner with Mount Sinai. I'm very happy to be part of two different teams. One of the teams I'm part of is the REACH program at Mount Sinai, right up here. The REACH program partners people who are in, okay, I don't know if I can repeat the names. We're in 28 days. So Reggie's where they're at, offer Hep C treatment, do education, explain to them about what the resources are, and then I will meet with them via telemedicine, and we will provide treatment while they're at the rehab, while they're there also addressing their substance use. And yesterday, if you were on the beautiful call about hepatitis C and the state we're at, Reggie did a presentation. He did a great job. Also on my team is Arena. Arena will also go to rehabs, and she will go to opioid treatment programs, also meeting the person where they're at, offering them education, hepatitis C treatment. I will do the telemedicine, same thing, and the OTP, and we will bring the medication to the people. Marina is also bilingual, and we are proud that our team brings a lot to the care. And then we have Farah over there, who's holding the sign for me for the next partner that I work with. Farah leads our team. She also goes to the OTPs. She's also bilingual, and she does an amazing job running our program at the REACH program. A shout out to the REACH team. Yeah, and that is a grant from CDC that is funneled through the City Department of Health. So thank you to our City Department of Health partners who are all over here. The other grants I'm also affiliated with is through Mount Sinai, and it is an Innovative Models grant funded by the State Department of Health. So what we do is we provide hepatitis C treatment in a low threshold production agency called Vocal New York. Vocal is always in the house, let me tell you. And we provide laundry, we provide showers, we provide food, care coordination groups. Low threshold, almost all the people that we work with are actively using, but they are given love. They are not given judgment, and they are given warm embraces. And we also do prevent overdoses and do Narcan training, etc. That's at Vocal New York in Brooklyn, New York. And we have been able to treat people for hepatitis C in a clinic that is located in that setting. And so that's another type of work I like to do. And what I'd like to leave you with is the gift I get that keeps on giving. On Monday, I was doing a session with someone who's at an opioid treatment, actually a rehab program, Arena and I. Arena brought the medication to this person. Actually, it wasn't opioid. She brought the medication to the person, and so after we talked, I said to the person, "Do you have any questions for me?" And he said yes. He said, "Happy Mother's Day."
Oh, that's sweet.
And then I said, "Do you have any other questions for me?" And then he said, "Can I give you my blessings? Because what you're doing, bringing the medication to my program and making this possible for me, I'm so appreciative." And I said to him, "You know what? You give more than I give you. And your blessings and your thanks and your appreciation." And by the way, his liver is a little bit damaged. This didn't have to happen. Okay? It could have been treated sooner. We didn't have to have liver damage. But thankfully, he's getting it treated now. We're going to do the blood work at the overdose treatment program. We're going to keep in contact with him due to our amazing team. And that's the kind of work we should be doing, going where the people are already going. They're already engaged in care, but we're not there enough. But look at this team. And the last step is to start I was learned to do hepatitis C treatment through the PCORI study. So thank you to the START team, and thank you for listening to me.
Yes.
Thank you, Abigail, and thank you so much for your commitment and the work you're doing. Definitely needed in our community. We need more like Abigail. Now I'd like to introduce Julie Yoshimachi, and she is the Hep B Program Director at Charles B. Wang.
Hello, good morning, everyone.
Good morning.
I'm Dr. Julie Yoshimachi. I'm from Charles B. Wang Community Health Center. I'm here with my amazing team and colleagues today, and I'm so honored to be here with all of you. You know, first of all, thank you for all the hard work you do. I'm so inspired by you guys every day, so thank you so much. And I'm honored to be here with you and represent and advocate for this amazing work that we do every day to be one step closer to eliminate viral hepatitis. I'd also be amiss to be able to mention it is, also Happy AAPI Month, and 58% of hepatitis B patients are AAPIs, so such a crucial thing also to mention. As a clinician, I'm a nurse practitioner in primary care as well as the director of the hepatitis B program, but as a clinician, I see patients, I've been in multiple disease processes, but I've never been more frustrated working in hepatitis. We have the tools, we have vaccinations, we have screening measures, and such amazing people who want to do the work. So why are we not talking about this more? We don't give enough attention, and so hope, but again, continuing the amazing work we're doing, we can definitely do this. Hepatitis, as you know, is the leading cause of liver cancer, and liver cancer is the leading cause of cancer-related deaths in the world. Again, we have the tools to make viral elimination of goals a reality within the next 10, 20 years, and why are we not stepping up more? Wouldn't it be great if, 10, 20, 30 years down the line, people are like, what's hepatitis? We haven't seen that in like 20 years, right? That's what we want. So let's definitely make that a reality and make hepatitis a past history that's been eliminated with our efforts. This is a crucial time. So let's definitely move forward and continue to work together. And again, thank you to everyone for their amazing work. And I look forward to the next year and bringing forward with our amazing efforts. Thank you so much.
Thank you, Dr. Yoshimachi. Now, before we get to the next speaker, I would like to acknowledge also Councilmember Chris Banks, who was here earlier taking pictures, but we do have his aide, Francine, here. So thank you so much for being here. Now I'd like to call Luis Mares, who is from the Director of Community Mobilization at Latino Commission on AIDS, who is also a very long time advocate. So thank you.
My name is Luis Mares, the Latino Commission on AIDS. I'm representing here National Hispanic Hepatitis Awareness Day. Each May 15, since 2012, it's 20 years already, we observe National Hispanic Hepatitis Awareness Day to address the disparities associated with viral hepatitis in the Latino community.
Un poquito más alto.
Okay. The goal of our campaign is to educate and mobilize the Latino community through the USA, Puerto Rico, and the Virgin Islands to increase awareness and knowledge on hepatitis and its impact on our community. Since 2020, we have now a plan to eliminate viral hepatitis in the United States, but there are still several blocks to get to the main goal. There are still certain states in the country in which they're making it impossible for some people living with hepatitis C to access treatment. Since then, some goals of this plan have been achieved, but not all of them. The CDC recommends some strategies to be able to implement the plan, including testing, vaccination, and treatment for adults and children. Improve viral hepatitis surveillance is very important, and expand harm reduction services for people that use intravenous drugs. We know that Latinos are not the most affected group of people with hepatitis, with a high incidence of cases, but we also know that if once we get infected with hepatitis B or C, we progress to chronic conditions and complications more frequently than other groups. But we need better surveillance in order to be able to apply programs that Latinos and other communities that are affected by hepatitis. This year, NHAC is focused on testing. Again, we know that over 40% of the people living with hepatitis C is unaware of their status, and in the world, more than 90% of people living with hepatitis B is also unaware of their status. So it's important and urgent to identify these people in order we can provide them with treatment and decrease the number of transmissions. NHAC continues to create awareness and encourage ways to reduce the impact of hepatitis among Hispanic and Latinos. We call the federal government and governors in our nation to increase funding to address the hepatitis epidemic in our communities and increase surveillance.
Thank you, Luis, and thank you for your leadership.
Next time you need a microphone
Yeah,
because you need.
I know. Now I'd like to introduce Mohammed Razi, who is the Executive Director and Founder of the Council of People's Organizations.
Hey everyone, how you doing? We gotta be loud. Free New York City. What do we want? Free New York City. What do we want? Free New York City. What do we want? Free New York City. When do you want it? Now. When do you want it? Now. That's the way to do it.
Un hombre con una voz
My name is
fuerte.
Mohammed Razvi. I'm the Executive Director and the Founder of Council of People's Organization. We service over 45,000 people annually. During COVID, we were servicing over 30,000 people weekly. There's so many of our community members, as you can see, that are here, who are always affected with multiple issues. And health is one of the biggest issues. 50% of the people that come to our office need health insurance, and many of them are not aware of what they are able or entitled to get. And especially regarding with hepatitis, it is a huge issue in our communities, and we need to stand together. Now we have the agencies, and we have the city council members and the community partners together. We are gonna get this done. Thank you so much, all right?
Ese es un hombre con la voz fuerte.
Thank you.
What do we want?
What do we want? When do we want it? Now. Yes. Now I'd like to introduce Christina Boyd. Please come forward.
Cristina.
Everyone, my name is Christina Boyd. All right, I'm gonna try real hard to be louder than that. I don't know, but I mean, y'all know. I
Try it. Do your best. Do your best.
All right. For the past 7 years, I've had the privilege of serving as a community health worker at Bronx Care Health System in the Department of Family Medicine under the viral hepatitis program. I've dedicated myself to educating our communities on preventing the spread of infection and advocating for vaccination and ensuring treatment and cure for hepatitis B and hepatitis C. Every day, I'm honored to work alongside incredible individuals. They're not just our patients, they're our community, our neighbors, our friends. They deserve every opportunity for a cure and treatment. Yet as I reflect on my journey, watching the cost of living skyrocket, we can't ignore the challenges that we face with the governor, and I acknowledge that City Council is helping, and due to this, we've been able to make the strides that we have. When I first began, our team was larger, way more robust, but now it's just me more or less. I have my team now. And then I have the support of everybody here, so that's But despite these challenges, there is hope. Every day we're making strides, raising awareness, and forever building momentum in ending the epidemic of hepatitis C and B. Now, we could do that with more funding from City Council campaign. New York City is a beacon of diversity and resilience and should always be a leader in healthcare. Our community deserves it. There's a cure for hepatitis C everyone should have access to. There is treatment and there's vaccines for hepatitis B. Everybody should also have access to that. We can break down those barriers with making it so insurance has to pay for it, not just City Council. So we can make it where our communities are covered by, we have this beautiful city, we have the funds to do this. But unfortunately, we can't really rely on the government. Well, I'm just gonna end and say thank you for your time, and I appreciate the opportunity.
Thank you, Christine.
Eso es Cristina.
Now I'd like to introduce Anthony McLeod, and he is a program manager at START, New York.
Good morning, everyone. First, I want to acknowledge our hard-working team at START and all of you advocates for hepatitis C treatment. START Treatment Recovery Centers is the nation's largest Black-founded and led community-based treatment research and organization that transforms healthcare delivery services and substance abuse and mental health disorder. Our successes in making treatment for hepatitis C available for our communities did not occur overnight. It is the commitment of our leaders. It is the dedication of our providers. And it is the excellent work of our patient health navigators that have played a pivotal role in the engagement and education to dispel misconceptions associated with HCV infection and treatment. Our patient stories range from one of fear and desperation initially at the time patients are diagnosed, to one of joy and elation at the completion of treatment. We have a number of success stories among our patients where treatment has been successful. When we met Maritza, a 68-year-old grandmother, she was afraid she would pass the virus to her grandkids. She's now happily cuddling and kissing her grandkids, worry-free after being cured. Reggie, a 50-year-old African-American with cirrhosis, thought there was absolutely no help for him based on the stage of his disease. He was cured, and he is looking forward to the next 50 years of better quality of life. Philip, a 34-year-old Caucasian male, thought that the 35-mile distance from where he lived to the program was an impediment for getting treatment. I personally delivered Philip's medication to him on a monthly basis. Philip is cured of hepatitis C and is thankful for the personal service that we render. I want to thank you for the opportunity to present and share the work that START do. This work could never be done in a vacuum. It absolutely takes a village. Our success include partnering with the F3NY network to facilitate our work at START. It is the commitment of the START leadership in supporting the work as it aligns with our company's core values of compassion, equity, sustainability, and innovation. The elimination of hepatitis C depends not on one of us, not on some of us, but on all of us. Our collective effort will go a long way in the elimination of this disease. I want to thank you for this opportunity. God bless you all.
Thank you, Anthony, for your commitment and your leadership. Now I'd like to call Melissa Nieves, who is a patient navigator at La Casa de Salud.
Good morning, everyone. So today I want to talk to you about something that affects millions of people in the world, right? The hepatitis C virus. Beyond the statistics and the medical jargon, HCV is a